is Dr. Gregory Lakin. I'm a board-certified plastic surgeon, and I'm from Fort Lauderdale, Florida. So I've enjoyed working down here at the South Florida Center for Cosmetic Surgery to provide cosmetic surgery for the patients of South Florida and those that fly in from other states. So ab etching is also high-definition liposculpture of the abdomen, and it's where we sculpt out the abdominal musculature. It's not just liposuction, which is where you suck out as much fat as you can, but in etching, you're sculpting, you're creating shadows and contours in the abdomen to make it look like you have a six-pack. Oh, and the best patients for this are patients that have a regular body mass index, which is a height-weight ratio between 18.5 to 25, so that's the normal range. And basically, if you're within your normal body weight, you are probably going to be a better candidate than if you're overweight. If you're obese, where your body mass index is greater than 30, then you're not really a candidate. There's two different types of etching that can be done. One is on a man, the other is on a woman, and the male etching usually is like a six-pack creation. The female etching usually is not a six-pack, but rather lines that are created along the midline and the sides. And that gives them a more athletic and toned look. Some women want to have a six-pack, and that can be done as well, but that's more for like a fitness model type of women. Most women just want to have a beautiful, soft, natural curve. So there's two types of breast implants that can be used. One is silicone and one is saline. Silicone feels a little more natural, costs a little more. Saline also feels good, though I think the decision for them is based on a personal preference, and patients that generally don't have very much breast tissue to start with, I usually recommend using silicone. If they have more breast tissue, then you won't really feel the difference under the breast, so you might want to go more economical and use the saline implant. Implants tend to get replaced every 10 years or so. You don't have to get them replaced at 10 years, but it's if they're feeling hard, that's a capsular contracture, or if you want to change in size. For instance, if you're at a different phase in life and you want to go bigger or you want to go smaller. Some people have had children and their breast change shape after breastfeeding, so it doesn't really have any effect if you get an implant and you want to breastfeed afterwards. You can still do that for the most part. We choose the size of the implant based on patients' goals and their body frame. So if they want a big implant, we can do that as long as it sort of fits within the frame and it looks good. If you don't have enough skin or you're doing a lift at the same time, sometimes you can't go too big, but you can get a nice fullness in the upper hole from adding an implant to those cases. There's a type of breast cancer that patients are concerned about with breast implants, and that is very rare, and it only happens in textured implants. We don't use those types of implants, so you don't have to worry about that. So general anesthesia is considered very safe, and some people can get certain procedures done under local anesthesia. They're usually smaller procedures. I have done liposuction under local anesthesia. We don't tend to do that here. I've done upper blepharoplasties under local. Those are skin excisions of the upper eyelids. And sometimes neck liposuction can be done under local. Some people are concerned about swelling and bruising after surgery, and to minimize that, we give everybody a compression garment to wear. I'd recommend wearing that as much as you can for the first month, usually 23 hours a day, except for when you shower. And then after that, as needed, up to 3 to 6 months until all the swelling goes away. And arnica can also help with bruising. That's a ointment or a pill. After a mommy makeover, which is usually breast lift with implants and a tummy tuck and liposuction, to speed up recovery, I would wear compression as much as you can, 23 hours a day for the first month. Also, I would consider doing lymphatic massages in the areas that have been liposuction, and that's where you massage on the skin to make it smoother and reduce the swelling quicker. Tummy tuck is a skin excision and tightening of the muscles and repositioning of the belly button in patients that have excess skin and a diastasis recti, or separation of the muscles, usually after pregnancy or if they've gained a lot of weight. And if you can get it as a man also, it's not just for women, specifically if you have massive weight loss. And if the skin excision, and some patients have excess skin that wraps around to their back and can be excised as well. That's a circumferential tummy tuck. That's usually in patients that have had massive weight loss. So facial rejuvenation can involve anywhere on the face, such as the brow, the eyelids, the lower face, and the neck. There's different incisions for these different procedures. For brow lift, they can be hidden incisions in the hairline. For the facelift and neck lift, there are incisions around the ear. And if they're mini facelift, it's usually a smaller incision around the ear. And there's the decision of which type of facial procedure to go with is based on your individual needs. So if you just have mild laxity of your cheeks and jowls, then a mini facelift is fine. If you have significant laxity and neck laxity, then you should probably get a full facelift. If your eyebrows are falling down, then that would be a brow lift. Some patients are interested in having their cheeks made either fuller or taken down in size. So if you'd like them made smaller, there's a buccal fat pad excision, and if you'd like them made larger, there's fat injections that can be done. So patients want to know, when they get a BBL, will they get a dramatic result with just one surgery? Will they need a tummy tuck? I think the best results are when you can improve the waist to hip ratio. So if you would benefit from a tummy tuck, I would definitely do that. Some patients do have a lot of excess fat, which they do need 2 BBLs to liposuction all the fat away and also give them the largest result as possible.